Good morning and welcome to all my dears. We had completed the two causes of peptic ulcer disease. That is number one, Helicobacter pylori infection or H. pylori infection. Then with a drug-induced peptic ulcer disease, that is NSAIDs. So today we are going to discuss about other causes of PUD. As you know, one of the main cell in our gastric mucosa are by parietal cell, the cells which responsible for the synthesis and regulation of gastric acid. But unfortunately, in personalities with a tumor in stomach, especially parietal cell tumor or P cell tumor, results in uncontrolled or persistent secretion of gastric hydrochloric acid. You know that the secretion of gastric acid and other secretions are mainly regulated by our parasympathetic nervous system. The secretion may be in the form of conditional or by unconditional reflex. But here, without having any such regulation, stomach of our patient will continuously or persistently secretes the gastric acid, and thereby the mucosa may fail to resist the corrosive effect of high acidity, and thereby chronic gastritis and peptic ulcer may be the result. Another set of tumor, that is tumor belongs to G cell, that is the cells which are responsible to synthesize the hormone known as gastrin. Constant stimuli of gastrin to the parietal cell results in gastric acid secretion, uncontrolled level of or high level of gastric acid secretion, and the same will results in hyperchlorhydria or high acid content in our stomach. Both of these two conditions leads to peptic ulcer disease. And other cause may be due to chain smoking or constant or prolonged use of alcohol. By smoking, you know that the smoke contains more than 4,000 biochemical ingredients in single puff of a cigarette or a BD or something like that. One of the main ingredient is nicotine, and along with other biochemical molecule, the effect of smoking in our stomach as in the form of damaging the microcirculation, preventing the prostaglandin secretion, and automatically all those things results in immunodeficient status that will leads to overactivation of the microbial flora, and thereby PUD is the result. Prolonged use of alcohol that leads to hyper acidity, and the effect of acetate or acetaldehyde or acetic acid results in chronic gastritis, and finally peptic ulcer is the result. Next, about the other conditions may par with our peptic ulcer disorder, and in patient with chronic liver disease like cirrhosis or hepatocellular carcinoma, and pulmonary disorders like COPDs, various COPDs or specifically empyema or cor pulmonale, hematological disorders like patient with polycythemia, then hormonal imbalance like Cushing syndrome, hyperparathyroidism. In such patient also you can see high incidence of peptic ulcer. It is very interesting one thing that the PUD can also be an idiopathic one. That means cause cannot be evaluated, or cryptogenic, something like that can be used. So these are the causes of peptic ulcer, even though the major four causes of peptic ulcer disorders are: number 1, H. pylori infection; number 2, drug-induced or NSAIDs-induced peptic ulcer disorders; number 3, smoking; number 4, alcoholism, etc. predisposed or to excite or to maintain or to lead as a chronic peptic ulcer disorder. And regarding the epidemiology, usually the PODs are relapsing lesions and are usually diagnosed in the middle-aged or older adults, and often it appears without any obvious precipitating cause also. About the male-female ratio, usually the male-female ratio for duodenal ulcer is 3:1, and of the gastric ulcer is 1:2. And that's all regarding about the causes and epidemiology of peptic ulcer disease. And next we have to study about the common symptoms of a patient with a peptic ulcer disease. I think that can be studied in another class or in our next class. Thank you for watching, and stay tuned, stay safe, keep social distance, always wear mask, keep your personal hygiene. Okay, thank you.